Hello again, welcome to video number 7. Some people worry that if it's not anxiety, what is it? What's the problem that they might be suffering with? That's an understandable question, and one which has plagued many people for many years. Sometimes other ailments feel like anxiety, but they're not actually anxiety at all. So it's a good idea to have something like a thyroid test, which can be arranged through any GP, or you can have blood sugar level tests. Very commonly, if you put into Wikipedia the symptoms of anxiety and the symptoms of thyroid disorder and the symptoms of blood sugar imbalance, you'll find that they're very similar to the symptoms of anxiety. So it could be that you've got a thyroid problem, which is easily corrected with medication and dietary changes, and it also could be that you've got a low blood sugar problem, maybe hyperglycemia or undiagnosed diabetes, which can also be corrected with medication and dietary changes. So what you feel when you feel anxiety, the sweaty palms, the shakiness, the disequilibrium, dizziness, instability, palpitations, breathlessness, things like that, needn't always be anxiety. And very often therapists and those connected with psychological remedies are obviously looking for psychological cures. That's known as selective attention, where you're actually looking for things you want to find. Sometimes not everything is anxiety, so certainly if you think you've got anxiety, have a look at the possibility of a low blood sugar problem or a thyroid problem, and it might be that your answers lie there instead of psychological reasons. Again, this can be easily arranged through seeing a GP. If you've had the thyroid test and you've had blood sugar tests and everything comes back normal, then maybe the problem is psychological. That doesn't necessarily mean to say that you will be going mad or going to a Victorian mental home, and things like that don't exist these days, obviously. They used to incarcerate almost anyone for anything 120, 150 years ago, but fortunately that doesn't happen. So if your problem is anxiety, then those things can easily be corrected with things like talking therapies, which would include cognitive behavioural therapy or person-centred counselling, or medication. That would include the normal SSRI antidepressants, which stands for selective serotonin reuptake inhibitor antidepressants, or for a very short period only, certain kinds of tranquilizers as well if you're going through a really bad time. So those things are worth looking at. But again, the purpose of this video is to make sure that you don't just assume it's anxiety just because the symptoms appear to be anxiety. There are many other things that it could be that need ruling out before that's the obvious conclusion. Thank you for watching. See you next time.